All right, we're going to talk today about how we maintain quality in nutrition and dietetics practice. And this is really a discussion about how the profession assures quality and holds us accountable to the practice that we do. So let's start by defining quality practice. Quality practice in nutrition dietetics is built on a foundation of two main things. One is the initial quality of the educational process. So right now you're undergoing the undergraduate course content, which is building your education. If you choose to become a dietetic technician, then you're going to take the DTR exam to prove your knowledge. And if you're going to become an RD, you're going to go on to an internship where you're going to gain more skills and knowledge, and then you'll have to pass an exam. So all of those steps assure quality education. And then once you've earned a credential, either the DTR or the RD, you then need to maintain it. So quality practice is going to set up some type of a system in which we can evaluate your ongoing competency. So, in other words, just because you pass the RD today doesn't mean that you're necessarily competent 20 years from now if you didn't practice and now you want to go back and work in a hospital setting. So, the idea here is how do we maintain the integrity of your credential, your RD or your DTR? And we typically do this through ongoing continuing education. But this is all part of quality practice. So our ultimate goal is to assure that the professional is competent. So let's start with a discussion of why competency is important. So obviously, as healthcare practitioners, we want to make sure that the work that we're doing is safe for the public and provides a quality product. If we practice unsafely, then we could hurt somebody or we could just be ineffectual. And in doing so, we can also undermine the credibility of our credential. The same goes with quality. If the quality of of the work we do not only reflects upon us, but it also reflects upon the entire profession. All right, so where does defining the quality of practice begin? And it begins with the development of a code of ethics. And the dietetics profession does have a code of ethics, which we're going to talk about a little bit more depth in class. And you'll be doing some basic reading on the code of ethics prior to class. So we always, with many professions, they have a very clear code of ethics. So let's define what a code of ethics is. So first of all, a code of ethics is going to define set rules for how a practitioner in that profession is to behave. It's also going to provide us with a statement of what is normal for the profession, the behaviors that are normal for the profession and what they do. It might also define what the core values are of that profession. One of the benefits of a code of ethics is it can help the practitioner identify whether or not what they're doing or thinking of doing falls within an ethical practice. And last but not least, a code of ethics, when adhered to, can ensure the safety of the public and the trust of the public regarding our profession. Okay, so once that code of ethics is defined, we can then utilize that code of ethics to build more structure around determining what quality practice looks like. So in the dietetics profession, in addition to a code of ethics, what they have done is defined a couple of different levels of information related to what quality practice looks like. So we have something called scope of practice, and we have both scope of practice for the RDs and a scope of practice for the DTRs. There's also something called the standard of professional performance for both RDs and DTRs. And the standard is essentially exactly what it sounds like. How do we define what professional behavior is for our profession? Whereas scope of practice is more about what we can and cannot do as a nutrition professional. Okay, so to redefine, a scope of practice basically defines the roles and activities and regulations within the RD regulations that the RD or DTR must perform within. All right, so what determines what our scope of practice is? Well, there are a couple of things that we need to take into account. One is the statutory or the legal, the laws that say what we can or cannot do. And there are going to be some federal laws and some state laws, and the state laws will vary from state to state. But basically, this is saying that you can or cannot work in hospitals or nursing homes, or whether you can or cannot get paid from insurance companies or from Medicare, what your legal liabilities are, etc. So really, these federal and state laws will give us the overriding definition of what we can or cannot do as a DTR or an RD. And then there's the second piece of it, which is, the individual identification of what you can or cannot do. I identify this as what you're ethically able to do. In other words, whether you're properly trained for it, whether or not it's the right thing to do, whether it's a safe thing to do, all the things that are identified as keeping the public safe and doing quality practice. So some of the things that fall under that that determine individual scope of practice is obviously credentials, certifications, the level of education you've received, what kind of training you've received, and ultimately the type of experience you've had. What's important about the scope of practice is it's basically saying that you must only practice or do work in areas you are qualified and have demonstrated competency in and are legally able to perform. So essentially, the scope of practice as written says what you can do, under what circumstances you can't do it, and also how to determine ultimately to determine whether you're competent to perform those functions. All right, and that's where the standard of practice comes in. So we've got these general scope of practice that basically says what an RD can do and what a DTR can do. And they're very specific about the kinds of work that you can or cannot do. And then what we also have at the Academy also has is specifics about standards of practice for the DTR and the dietitians. It basically is going to define the minimum competency levels for dietetic practice and professional performance. So it's basically it's saying basically you have to be able to use up-to-date information, knowledge, skills, and best practices. You need to make decisions using data and evidence. You need to communicate effectively with clients, patients, and others. You need to critically evaluate your own abilities and competence, and you need to seek additional experience, information, and support as needed to maintain or improve competence. So essentially, you are responsible for your personal competence and practice. So here are some examples of what standards of practice looks like. So basically, it's saying that RDs and RDNs are accountable and responsible for nutrition care of individuals utilizing the nutrition care process. So any activities under and any activities under the DTR scope of practice. So basically what they're saying is the standards of practice are saying that RDs are going to do the nutritional needs of patients, clients, utilizing the nutrition care process, and then any of the below mentioned scope of practice that is also under the DTR. So under the DTR, what we have is you could provide basic patient care using nutrition care process. You're going to provide nutrition education for largely healthy populations, consult with food nutrition services, conduct nutrient analysis, collect data collection, manage food nutrition services, etc. So this is basically saying These are examples of things that you as an RD or you as a DTR are identified as having within your scope of practice, and there are standards of practice related to them. Furthermore, there are specific standards of practice for different types of work within dietetics. So, for example, there are guidelines specifically for dietitians that are working in medical nutrition therapy. There are standards of practice guidelines specific for dietitians working in nutrition support, diabetes, disordered eating, etc. So these also can serve additional information to help you identify whether or not something is within your standard of practice. All right, so let's take a little bit of time and let's define standards of practice for your practicum experience. So in other words, we're not RDs or DTRs yet, but we can use these same concepts to determine standards of practice or scope of practice for your practicum sites. Okay, so here are the reflective questions that I'm going to ask you to answer for homework. What I'd like you to do is write down 3 tasks you've been asked to do by your practicum site. They can be anything. They can be big, they can be small. Maybe you were asked to do a bulletin board. Maybe you were asked to do a class. Maybe you were asked to conduct a focus group. Doesn't matter what it is. Maybe all you did was write a newsletter. But whatever it is, I want you to identify 3 tasks that you've been asked to do at your practicum site. So now the question are these tasks associated with your scope of practice? And we really want to be saying to ourselves, am I safe and competent to do these things? So here are the questions we need to answer. And you're going to do this in writing and submit on Canvas. So the first question is, has this activity become routine for practicum students and or the employees of the organization? So in other words, in some ways you're functioning as an employee of the organization. So if you look around, is this kind of standard work for them? Is this something that you would expect if you were in a paid position in this organization? Would this be the kind of work that would be standardly expected? And that's basically a yes or no question. So then the next question is, can I legally do this task? So in other words, do I have the credentials? Do I have the, does the organization say that A, this is your job, and B, legally, is it okay for you to do this? Another way to look at that is it ethical for me to do this task? Are they asking you to do something that you feel is not the right thing to do? Another question to ask is this task routinely done by someone with my education or background? So again, in a practicum site, you may or may not be doing high level work, but if you look around at the others that are doing similar work, do you have at least the minimum education and background to do it? And the last question is, have you received the necessary training, education on this task or the skill necessary to do this task competently? So in other words, in school or through your other activities, have you been trained, maybe on your practicum site, have you been trained to know how to do that? So if you're having to do a PowerPoint presentation, obviously we teach that in the undergraduate program. So you would have had some skills there. The question is, do you feel that you're competent to do that? So once you answer those 3 questions, it's going to determine whether or not the job or task that you've been asked to do is within what we'll call your scope of practice as a practicum student. So reflect on these 3 tasks, type up your answers, and upload them to Canvas.